Can you see the Word document?
I see it looks like a PowerPoint, but yeah.
Yeah. Okay, cool. Okay. Hi, everyone. This is your host, Lucy Corona, for Health and Money Talk, a podcast to talk about all things wellness in the Taft-Hartley Union world. What you will get here are stories that our gracious guests share about their own experiences about health and money. Together, we share insights, learnings, and maybe even some laughs. Our goal is to share stories with the intent to learn. We are not here to advise or provide solutions. We're here to simply share. Today, we have business representative from Teamsters Local 665, Tom Woods, based out of Santa Rosa, to talk about what to look for when negotiating benefits and its impact with health. We hope you enjoy our chat, and let's get started. Hi, Tom.
Hey, how you doing, Lucy?
Good. Welcome to the podcast, and Happy New Year.
Yeah, thank you. I appreciate the invite.
Yeah, of course. Thanks for being on here and sharing a little bit of your time and a little bit about you. So before we get started, tell us a little bit about you and, how long have you been with the local Teamsters?
Well, I was a general member. I was a truck driver for 15 years, and 3 years ago, I got hired on as a business agent. Before that, I was a shop steward, and I was on the negotiating committee with my bargaining group. I've always had an interest in collective bargaining and what we do here, and that's kind of how I ended up being on the negotiating team and how I ended up being a steward. And the time came, as lives do develop, where it was time for me to get out of the cab so that I could be home more. And there was an opportunity to be a business agent. This is actually the best job in the entire world. And I get up every day excited to do it. And I go home way too late because I can't stop doing it. And, it's just, I think finally figured out exactly who I am, which is great. I'm a father, I'm a husband, and I'm a business agent. And those three things that's it.
That's awesome. That's really great. And especially right now with everything going on with the pandemic, to have a job, family, shelter, like all of those things, must also feel really good despite everything happening. So congrats, and I'm happy for you. And so what about being a business agent? Like, I know it's it's a service to your members, right? You hear members and negotiate, like you said. But I feel like there's like a service aspect to it too, and that, you take member issues or problems and try to find solutions.
Well, yeah. So, as a business agent, I've got a lot of roles and a lot of hats. Before, when I was a truck driver, the hardest decision I made every day was, what uniform I was going to wear, clean or dirty, right? And that was a great job, and it came with a lot of benefits. And, the biggest benefit was, well, it goes how it goes. But, that is a benefit, right? I mean, that is, in a sense, a really great thing about a job, because all I had to do was go from A to B and not run into anything. And at the end of my day, I got to go home and I didn't think about work. There's no reason to think about work after that. I was very much living in the moment. And in that sense, it was a really good job, because I got to spend my time thinking about the things I wanted to think. And, I listened to a lot of podcasts and audiobooks and things like that, because my job really was just to not run into things, just get somewhere safe. My job today is great for all the reasons that the other one wasn't. It's incredibly varied. There is a service aspect, right? I mean, members are paying dues that pays my salary, and they expect help with, all the little things that come up in their lives. I mean, it's, for the purposes of this podcast, it's helping them move through the bureaucracies of their medical insurance that's negotiated, helping them make choices about enrollment in different plans. But it's also, in the case of discipline, help making sure that any discipline that they face is fair, and that, that the company did a full and fair investigation of what's happening, and that, any discipline that they face is, in line with past practice and, makes sense. There's
Right.
other demands on this job. I've got a political component. I work with city councils and county supervisors, trying to advocate for policy that improves the lives of my members. It's a 24-hour day, 7 days a week job. I'll start a day 2 a.m. crawling through a loading dock trying to do some organizing at a freight company, and then 4 a.m. I'll be where people are clocking in, talking to them, just checking in to see how they're doing at work and making sure that they're safe. And later in the day, I'm in the office, as we discussed, trying to figure out why a 14-year-old hasn't been able to get a impacted tooth pulled, and make sure that that member's, that kid's parent who's working and has earned this dental benefit is getting what they paid for.
Right. Because paid for them to be able to.
Yeah. So it is. It's a service job. It really is, and it's different every day. I make appointments and I have a plan, and sometimes that plan just goes out the window. And I get to be comfortable, and I get, and I think about it when I go home. And like I said, driving a truck was very much a job that had this bonus where I didn't have to think about it. And now I'm in this job where this bonus is, it's compelling and I want to think about it.
Yeah.
So.
Yeah. Yeah. It's fascinating the amount of hats you do wear. I mean, that's kind of where you started in saying that you wear lots of hats. You guys really do wear a lot of different hats. But all of it at the end kind of is for the better for a lot of people. I mean, the work you do services and helps and it makes the lives of so many people better. So while it might be more complex probably than the job you had before, it's probably more fulfilling. And it's amazing work you do also do. I mean, one of the negotiators folks that you work with is me, right? And in an aspect, as a Kaiser representative. But so I see the work you guys do and the thoughtfulness you guys have and how involved you guys can get too with some of that. So it's really interesting work. And your background, and what you've done, really interesting. You did that for a long time. And how long have you been in this current position?
3 years. Yeah, I've been with it for 3 years. I think you and I got hired within 4 months of each other in our current positions.
That's right. I remember that now. We started around the same time. I started in labor and trust working with you guys, I think July of 2017. So I think, you were 3 months before, like that.
No, it was January 18. So.
Nice. Yeah. So we're kind of both learning together. So you're a great guest for our podcast today to talk a little bit, just, kind of on the earlier side from an experience perspective of seeing, all that is happening within contracts, negotiations and whatnot. And then from my end, obviously doing the benefit side specifically, but really tying this all into how benefits and health are so connected and are, everything is connected, right? But they really work together because good benefits can have, one of the takeaways that we hopefully get out of our discussion today is good benefits can result in better health outcomes, which results in better business outcomes too, which can then help manage utilization and how people use the plan and the cost of that plan. And, so it kind of goes full circle. So, as we talk about all this, that's kind of, one of the main takeaways we'll get, we'll just kind of state at the beginning. But what I'm interested to hear from you, Tom, more about is, like the negotiating part, what you look for. So, what do you look for when you first look at a negotiating plan? So, we're just making up a situation or a scenario here where you have a new employer wanting to come into the union, come into the trust fund. Let's say they're banging on your door to come in, and hopefully that's how 2020 will happen, where we have lots of those cases. But, so what do you look for when you look at that benefit plan of that existing employer or contractor, whatever it might be?
So let me start. I want to reframe the question a little bit, and just say at the outset that what I do is very infrequent that an employer comes to me and says, "Hey, I want my workers to be union," because I represent workers, right?
I'm dreaming for you.
Sort of,
big.
What'd you say?
I'm dreaming big for you.
Yes. I mean, it could happen, and then I'd have to tell the employer, "That's great. I need to meet your workers because they get to make the decision. They get to decide what they want." And I really appreciate an employer whose heart is there, but really, we're a labor organization. We represent labor. So, but we're still starting in the same place. So what am I looking for? Well, the first thing I want to do is get to know the group and the group's needs. Because if we're negotiating for a medical plan for that group, it's important that the medical plan that we choose reflects the needs of that group. And one of the very surface things is cost, right? Plans get broken down. There'll be, one cost, which will just be an individual, right? And then there'll be, two people with one dependent and a family cost, or there could be a cost that, everybody pays exactly the same. And the term is skipping my mind because I'm on the spot, but for, an entire family, right? It's composite, right? And so, look at the group. And if the group is 90% young, single people that are not going to be, having kids right away, that's one thing that we're going to look at just off the bat is kind of that cost structure there. And if the group is, say, significantly older, that also changes, what we're looking for. Different things like, what level of reproductive care is going to get paid for. It doesn't matter. I've got a group that is almost all comprised of retirees. They're retirees, and they drive buses and community paratransit service. And you know what? They're not that interested in reproductive care. It's not a big deal to them. It's not relevant to that group. And so if I were to go shopping for a plan that had amazing level of benefit in that aspect, I wouldn't be doing that group of service, if that makes sense.
Yeah.
So that's
a great
one
point.
of the things, getting to know the group. And that's fundamental to, why it makes sense to use one of our welfare trusts in the first place, right? Is,
Okay. More about that.
We get this leverage in our negotiation by having a large pool, but then also the plan kind of gets tailored to the group and the group's need over time too. So not every, like our UPS plan that we have, which, isn't through Bear Automotive, but UPS is a gigantic employer. And so we bring a lot of people there, but it's also a fairly uniform employer in what the member needs. So the plan is actually not only cost effective, but pretty specific to the needs of the members. Over time it's evolved that way. And it's worked out really well. So that's my first thing is, what does the group actually need and what does the group want? It can't be my ego when I go into negotiation. I might have this idea in my head that, everybody needs a lifetime cap on their, orthodontic costs at, $900. That might be, my personal belief, right? But that might be crazy talk to another group. What is it that they want is number one.
Right. Yeah. That's a good point. And it is about really understanding who your members are and in respect to the benefits that you're looking at. So it's not just, this is a great plan, right? Like you said, it could have all the IVF benefits in there, but if your group is not necessarily wanting to be produced, then it's not going to be a good fit.
Yeah, exactly.
And I like what you said about the fund, the trust fund. The fund can provide lots of different plans. So that is one benefit of the fund, that they can have like a portfolio of benefits within one cost kind of community. So it all gets put together, but yet can have the benefits that one employer could need, and then offer a different benefit that another employer could use.
Yeah. And then the other first thing that I'm going to look at is really how much money can I get out of the employer, right? Because everything costs money. And, you know, I've got a lot of members that routinely hear from their medical providers that they have better insurance than the doctors themselves. And that's great, and I'm proud of that. It means I'm doing my job. I've done a great job. But that's not every group, and not every company can afford that, and we can't necessarily get that level of benefit for every group. And so we have to be honest about, what can we negotiate for? And we're always trying to improve, and we always want to do better for our members. But at the end of the day, you negotiate for a pile of marbles and you put them in, different pockets, but it's still that same pile of marbles. It just is what it is. So we have to, make sure that we're making plans that, I always want to put my members in a copay plan versus a co-insurance plan, right?
Yeah.
In a copay plan, every time you go to the doctor, there's a fixed cost, and it's going to be, $20 or $35, whatever it is, but that's what it costs. Versus a co-insurance plan where, the members go there knowing that the plan's going to pay 80% of the cost, and they're going to pay 20% up to the deductible. That can be a very expensive proposition really quick. I mean, a doctor's visit, okay, whatever, right? It's $250 and I'm paying 20%, and that's not so bad. But when my son falls off his bike and he's got a compound fracture, guess what? That's not cheap. And so I really try and get my members in copay plans over co-insurance plans, but there's a cost associated with that, and that's one of the first things I look at.
Yeah, and just to put it at that granular level, for listeners of the marble metaphor that you talked about, it's that some employers can't afford necessarily a copay plan, like you mentioned, where the member just pays copays for any doctor visits or anything at the medical center, any point of service, as we call it. And so what they can't afford is a high deductible plan. And so through the fund, they're able to pick and choose a plan that they can use. But the fund kind of is the bag of marbles, where it's, here's the different options that you can have. And these plans are better to buy through the fund because you're bigger as a buying entity.
Mm-hmm.
And so, it does give an employer flexibility to say, maybe this year we can afford one of those higher benefit plans where it's a copay, not a co-insurance, or be able to just maintain high level of benefits for members where they're still covered if something were to happen, if they need care, right? Because especially nowadays, having benefit coverage is huge. It's such a valuable thing to have right now. And so even if it is a high deductible plan, you still can provide that level of coverage so that they're not completely exposed. And so what do your members look for, however? And I think you kind of answered a little bit of this, but when a member looks at it and, and you are their rep, you're there to negotiate, the best plans out there for them. What are your members asking for? Like, what do they want? And I guess it can depend on the group, but in general, like what do you hear?
So the most important thing that I hear over and over again all the time is it needs to be a plan that's useful to them, right? There's a lot of plans out there that are like offer catastrophic coverage, and and really that, right? Or like you said, these co-insurance plans, and those plans really make people sicker because they don't get care. With a copay plan where it's $20 out of pocket, they go to the doctor. It's only $20, right? They want a plan that allows them to go to the doctor when they're kind of sick or they don't feel well and get better, as opposed to wait until they're dying. And I've actually seen that in the last year and a half. I had a member that had an upset stomach for 3 years, And when he got sick enough to go to the doctor, he died 4 days later of stomach cancer. And why was that? It's because he couldn't afford the co-insurance. And that was a company plan, that was not, we'd never been able to negotiate a good union plan in there. And that's a worst case scenario, but that's exactly, incomplete insurance or insurance that doesn't pay for the important day-to-day stuff. Those are plans that actually make people sicker. And businesses, given, just looking at their bottom line, would rather have a cheaper plan, and they don't think about, the savings in not training new people because their people got sick, or the savings in retaining people because, people are happier there. They kind of look at that monthly cost and just make a decision based on that. But my members want to use their medical insurance. They want to be able to go to the doctor. They don't want to have to look at it and be like, stitches or not, I don't know, can we afford it? That's tough. Jimmy's going to get a scar, and that's what it is. My members want to use it. And then the other thing that they look at is, what will their contribution be? Because a lot of my plans out there with groups, I always look for full maintenance of benefits, or the employer pays everything. But I've got a lot of employers that want to split it up as a percentage. 10% the member pays for, the plan cost, and 90% the employer pays for. And they think that makes people make decisions that save money. The employee needs some skin in the game. Say again?
And when you say contributions, you're talking about how much gets taken out of their paycheck.
Yeah, the plan premium. Yeah, get the employee to
right.
Pay
They're having to
percentage.
pay.
And again, that is always an attempt to stop people from utilizing their medical insurance. They tell them, if you're going to use it, the cost goes up. It's going to go up for you too. And again, we talked about that pile of marbles, right? I would rather put the marbles into paying the premium and not the check, because then you don't disincentivize people utilizing their medical insurance. But, at the end of the day, I negotiate with people based off their needs, and with people, with companies that have what they're trying to do too. And we do end up, often enough, having people pay a certain amount out of their check that they see. And that does discourage utilization of their medical.
It does, right. And I've been in the industry 10 years now. And that is one of the top things that I hear a lot of times from members, and when they feel disgruntled about just healthcare in general, is the cost out of pocket monthly.
Mm-hmm.
And how it seems to just continue to go up every year, because and one way that employers have found a way to mitigate some of that increase in cost out of pocket to members is by downgrading benefits, because less rich benefits are less expensive. It's going to be cheaper. Obviously, you're going to be more out of pocket if you need to use it. And so, so every member is going to be different, but for the most part, they're going to want to know, how much is that coming out of pocket, and then how much is coming out of pocket when I do go use the plan. And once we start talking deductibles, it really is unfortunate. So, that's an opportunity as the healthcare provider for us to better support our members, you guys, and how we can relay the message to members that if you do have a plan offerings by your trust fund or your employer, how can we support in members not feeling like they shouldn't use their plan because it might be too expensive out of pocket, even if they have a deductible plan, because there's ways around that, right? Like the example you gave of the guy that never got that checkup because he didn't want to pay the deductible for a doctor visit. And those doctor visits can be pricey sometimes. If you have a deductible, it can be up to $300, which for some folks, that's a lot of money. For me, it's a lot of money. $300 for a doctor visit, right?
I think, if I could have one thing in this arena, it would be for everybody to understand, like whenever we start these conversations, that you're paying for it one way or the other. If you take the money in wages, and then you have to pay more for your premium, you're paying for it anyway, because you're just going to pay it out of your wages. If you pay less for a co-insurance plan or a high deductible plan, you're going to pay it anyway, because someone, someone's going to get sick. I mean, it's not even a dice roll. It's going to happen eventually, right?
Right.
The cheapest way
Right.
to do it is to just pay for it upfront monthly, and
Yeah.
it just is. And that I wish companies and members would just understand that from the very beginning, instead of looking for ways to save money you're not going to save in the end. And then
Yeah.
not only are you not going to save the money, but you're going to have worse health outcomes.
Yeah. So it sounds like part of when looking at benefits and, health and negotiating all of that, part of it is not just negotiating for the best rate with your vendor, which, we haven't focused our conversation so much on that just yet. We've talked more as to the benefit just to the member and in that side of
Mm-hmm.
it, because how I look at everything I do when I go talk to you, what I think of is my end person, and that's going to be my member, that dad or that mom or that person that just has benefits for himself or herself, right? Think about the member, and then I think about you guys, and I know you guys are thinking about the member too. So that's why we started a conversation there. But there is a responsibility to the member in some ways where some education could be maybe beneficial, so that when you negotiate rates, you're kind of, it's all connected, right? If people use a plan
Mm-hmm.
better, then rates can be better managed. And it's a partnership, right? So it sounds like from what you just said right now that um, the member being more needs maybe right now a little more education on how to see the value of health insurance, either from a contribution, like their premium standpoint, and then their benefit standpoint too.
Yeah, no, absolutely. I think that health insurance is one of those things that we're taught to be scared of, and we're taught that it's
Yeah.
complicated, and it can be complicated, but it's one
Right.
of those things that education is so important, because these are
Yeah.
really impactful decisions.
Yeah.
So,
And,
I mean,
and you guys pay really good money for even those deductible plans that you might say, someone might say, oh, this isn't good. They might not like it. They're still a good amount of money. They're still expensive.
yeah, yeah, no,
You know,
absolutely.
and it is a subjective term. It's a, what's considered expensive. Um, it's not free at the end of the day. So yeah, how do
No.
you understand that pricing properly? And you and I, we live this world. We know the cost of these things. So, um, we might not think of it the same way as a member. So again, I'm trying to keep um, my perspective in the eyes of a member and how they might and how they perceive all of this. Um,
Mm-hmm.
but yeah, that's
And then, the other part of it,
agree with that point.
the other part of it is, people a lot of times, especially with, you know, employers in low paying industries where we're always trying to improve, they need the money. They do. They have to pay their rent. They have to
Right.
feed their kids. There are options, and so healthcare kind of gets pushed off, because
It,
people don't die because today you didn't have healthcare. They die because the last 4 years you didn't have healthcare. But people do die because they didn't eat today.
and then we look at further past that, and we look at what's their day-to-day eating, exercise,
Mm-hmm.
their lifestyle, right? And it is cheaper sometimes to get a McDonald's Big Mac than go buy a healthy salad. All the ingredients to
Mm-hmm.
make a healthy salad, um, and the convenience of the Big Mac, um, the cost, the convenience, all of that, and then you culminate it into years of eating unhealthy, and then they do become diabetic. But then where was there's just so much behind health where not just from a cost perspective do we leave it behind, but on keeping our health, which is really one of those invaluable things that we have. And if
Mm-hmm.
anything we learned from the pandemic is, health really is, what is it? Health is wealth.
Yeah.
There's a saying that health is wealth, because without your health, you can't work, you can't do anything, you're not living your full potential. And so, yeah, I mean, that's something that happens even to myself. Sometimes it's just easier to sit on the couch and relax than like go exercise. But I know I probably would do better in de-stressing if I exercise. We all do it. So, yeah, there's such a big conversation behind that. So when we talk about benefits and providing, it does get lost in the shuffle. So, how do we open that conversation then to members and that education to, it's like, here's benefits, but there's still, it's not just a premium you need to pay into it, it's your lifestyle that you need to almost like pay into it to avoid having to actually use the plan. And I'm not saying avoid using the plan altogether. Definitely if you're sick, come in. But and also when you're healthy. Um, so what has this pandemic changed things for you? And or has any of your process of how you approach benefits, how your employers or your members even are looking at benefits, has any of it changed because of the pandemic?
Well, I mean, the way I view medical insurance hasn't changed at all, because I was always someone
Okay.
that placed it very high up in my list of things that were important. And
Right.
the way I negotiate really hasn't changed at all either. I answer a lot more questions these days about medical insurance of people that are have concerns. And my day-to-day work day looks very, very different, but it's not really, you know, it's not super relevant to this topic in the sense that what I do, like from a negotiating for medical insurance standpoint, hasn't really changed. My contact with my members has changed, and it's unfortunate, that what we do stuff. But I'm still out in the field meeting people and talking to them.
Yeah.
I just talk to them from 6 feet away outdoors, while we both wear masks.
It's not the same, yeah.
Yeah, I think everybody at this point has realized that Zoom meetings are not as productive as group meetings. And so
Right.
when we have proposal meetings and talk to members about these things, in one sense, because I work so hard to make sure that everybody gets a chance to talk, and I've got a list of people for participants next door, I call on people more, but also people that have a lot to say don't get to say everything that they would normally say in a meeting.
Yeah.
But I don't feel that, call me blessed, right? My day-to-day hasn't changed that much. My goals haven't changed that much. If anything, it looks like most of my medical plans actually have slowed down their rate of increase or even decreased in cost. And I think that's a lot because people are so one, people are not at work, right? So they're staying home, and
Yeah.
people's behavior changed. So a lot of behavior that was always risky, but didn't come with the threat of COVID coming over you, has changed and gone away. So,
Yeah.
Flu, I sure looks to me like flu transmission's down, probably because everybody's washing their hands and wearing masks.
Yep.
Yeah. So it looks like there's less utilization, which is generally a bad thing in my eyes. It means people aren't going to the doctor, but it looks like it's for the right reasons. Like people are healthier because they're making better choices right now.
Yeah.
And you probably have some more finer insight than I do on that, because you see the numbers, like the real numbers.
We did see the dip. We saw the start, kind of drop in utilization, especially when shelter in place first happened in March and April, especially April, because March was like, I think the shutdown happened here in California like 15th, halfway through the month.
Mm-hmm.
But in the most recent months, the utilization has started to pick up in different ways than before, because now we have COVID utilization kind of mixed up in there, but it's starting to come up. What has not come up at the same rate are those preventive visits, and those preventive visits are very crucial to finding those issues early on, whatever that issue might be. But especially like cancer, diabetes, heart disease, those things, we were able to have higher volume of people getting those screenings and whatnot sooner. We're not discouraging them, but with COVID protocols, it does slow down the process. People who had appointments, they had to get deferred. Some people might have not rescheduled it, So while yes, utilization for the most part has been down and it's been okay and looks good, we also don't know what sort of impact that will have long term. Again, because we're not catching we don't know what we're not catching right now. So it's unprecedented,
So
right? This is an time.
Are you guys thinking that 2022 is going to be like a year where the balloon pops and we see a bunch of like breast cancers and other diseases that we typically screen for that are just not being screened for as rigorously in the last year? Is that something that you guys are looking at?
It is. Yes, we realize that there's probably going to be an uptick of something that's been pushed down, But again, like I said, these are unprecedented times. We also don't know for sure mental health cases and mental health needs and mental health. The residual of all of this happening has taken a big toll on people's mental health. So there's likely to have it already is having some impact, but continue to have through the future. But there's also been a lot of benefit. Some people have become more health conscious. Someone who before was so busy with their lifestyle and didn't take the time to, take on those healthy habits of eating as healthy, exercising, now started to because they couldn't go out, So, and I'll use myself as an example. I am eating much more consciously. I take the time. I have more time to be able to cook healthy, prepare foods, exercise, those things that before were kind of wrapped up in commute times, all those in-person meetings. So while some people may not be getting those things and there might be an uptick, those screenings, and there's an uptick in maybe finding things earlier on, there might be a decrease of the other folks who maybe changed their lifestyle and, now are healthier. So we don't know for sure if there will be an uptick like that. I think it'll kind of be hopefully it's balanced. We shall see. There's been nothing like this has happened before, so we don't have anything to reference. But yeah, so I forgot what we were saying before about like the keeping it back to like your benefits and members when looking at that. But the pandemic. I don't know. There might be some changes. I don't know. So far, it seems like, and you've kind of confirmed that, from your end too, there hasn't been a lot of change in how people look at their benefits because of the pandemic. I think we can all agree having benefits is great, especially during this pandemic. So if you do have it, I think you said, you're blessed. Yes, I think we all are, that we do have benefits, but I think the case will continue to be that you want to have them. You don't want to be left without insurance.
Yeah, I would say so.
Yeah. And, before we talk more about, when negotiations specifically and all of that, can you tell me a little bit about what kind of members you have? Like, what's the member profile look like for you?
Well, Teamsters are not like a lot of other unions where, they specialize in one thing and they've got a very homogenous group. We represent a lot of blue collar workers, right? We represent a lot of professionals. Our particular local doesn't have as broad a portfolio of like clerical staff that we represent. There's other locals for that, but we represent just people that work, that exchange their labor for money. Like that's kind of who we represent. And so it's a lot of truck drivers and construction workers. It's a lot of ready mix drivers. It's a lot of solid waste drivers. It's people that are essential workers. I'd say that, at least half, of our membership are just absolutely essential to the functioning of our society. And, they are people that are out being exposed. And they're also some of the best educated people out there on how not to get sick.
Yeah.
It's, my bus drivers, they will tell you, what percentage of risk is mitigated by one party wearing a mask versus two parties wearing a mask versus, amounts of airflow in a bus, or, how far away people are sitting. My members are very, very tuned in and concerned to that stuff because they are the essential
Right.
workers. They're the people that
Yeah.
are working right now. So,
Well, thank you
it's an
for
interesting time for
representing.
me.
What's that?
I said it's an interesting time for me because where a lot of people are working from home, my members are still in the field doing their work every day. And so I'm still in the field doing my work for them every day. And so,
That's awesome.
back to being blessed, I've got,
Right.
My day-to-day looks the same. It really does.
Yeah,
Except for the
that's
masks
great.
and distance between me and other people. We're doing what we do, and we have our exposure, risk. And that's just something that not only do we have to accept, but we have to work to mitigate, and we just understand.
And thank you for, to you and all of your members for doing that, because they are the ones keeping things afloat right now. All those deliveries, Amazon orders have spiked up, and a lot of delivery type services, but truck drivers right now are especially crucial during this time. So thank you. Well,
Yeah,
and I want to bring up what kind of members you have, because when you look at benefits, you did start off with saying that. So I figure, we kind of divulge a little bit, as to what kind of members you do have. And when you do, you definitely want to make sure your members have good benefits then, since they know the exposures that are out there right now. And switching gears over now to, negotiations and benefit packages. I feel like a lot of times we learn more in what we don't want to happen, or mistakes, or some of the things that are we wanting to avoid. So what don't you want in a benefit package? Like, what's something you'd like when you see it, you're like, oh no, we got to take that out? Or, is there anything, and maybe it is tailored to a group, but like, what's something that is like a no-no?
So I don't want to see high deductibles ever.
Okay.
Because
what's a high,
that just,
like,
what's it?
what's the threshold for you considered high?
I don't like to see more than $5,000 per individual in a year. Quite honestly,
Yeah.
I feel like that's, I don't like to see over $2,000, but once we get to like $5,000, we start talking about how people are making decisions that, not based on health, but based on affordability. And the real sad part about that is almost every time you run into a group with a high deductible, it's also a group with a lower pay scale too. All those two always go hand in hand. And those are the people that will not use their medical insurance if we negotiate it in, because they can't afford the deductible anyway. And so the company might as well not have that cost, right? It's not benefiting anybody. So high deductibles are one of my first no-nos. I don't want to see it. Number two, I don't want to see a lot of like limited access to mental health care. Mental health care is really important, and it's a place that people hide their savings sometimes, and I don't want to see limitations there. I want to see my members be able to get help that they need. Quickly, timely, and without having to embarrass themselves by telling people, a bunch of people go, calling 16 different people to get approved. Like, it should be as easy as, I need help, make a phone call, get an appointment, go in. It should be only consideration is, how am I going to get there? So, those are the two biggest things I don't want to see. I don't want to see, I just want to see the plan be used. I don't want to see any impediments to people using their plan. Like, that's at the end of the day, that's it. They're healthier if they use it. The plan will cost less if they get timely treatment, for little things. So that's one of my big buzzwords. What do you see as the things that we really need to avoid when we talk about this stuff.
That what you just said, we always make it a point of, I mean, that was the whole premise of the Affordable Care Act, or one of them, is why we want everybody to get health insurance, so that they can get the care that they need and have no incentive to not go, right? So if it's too costly, it's like to remove, the cost barrier and make it affordable, which, I don't know if we've achieved that, but that was the intent behind it. So you're right on to be concerned about high deductibles, because if they can't even afford it, then what's the point of offering the insurance if they can't even afford the whatever coverage is provided? One kind of side comment to that is, oftentimes we actually look at benefits and make recommendations, like as your account manager, of how can we change behaviors so that people are using the plan more effectively. An example of that will be if there is a high cost in the emergency room. We see utilization in the emergency room being super high. And a lot of those emergency room visits could be avoided if people call the advice nurse first, or used urgent care. Not everything is emergency room, like actual necessity. An example might be a kid broke out with a fever one night, and the parent might be concerned, legitimately, but it's probably not life or death. And emergency room is life or death type of scenario, or broken bone, like generally, not always, right? If you know your kid is, has other health conditions and they have a fever, well, then maybe that might be considered life or death. But I'm talking about like a healthy kid. It's winter time, flu season's going around, and they have a fever. That's likely not life or death. So there's different routes of how to get access to care then and there without using the emergency room, because the emergency room is going to be very expensive utilization. And if your copay is very low, you might just use it. So we'll make sometimes recommendations to increase the cost of emergency room, and it does change how people use the plan. So when people see the cost, like, oh wait, that might actually cost me $100 or a copay or co-insurance. Instead, I'll try my free resources first. So the hospital is still very low copay, but your emergency room is higher. And people will be more thoughtful on how they access care. So that's an example of a sub-example of kind of what you're saying of, people being motivated in the right way. And then the second comment you made about mental health, I love that you look at that. That's great, because mental health, I think, is actually probably even before a lot of these health conditions. So when we look at someone who became diabetic later in life, if we had looked at their mental health when they were younger, we might have actually helped them maybe get better mental health and earlier on, and avoid addictive behaviors or bad coping mechanisms that led them to, maybe poor eating habits and a poor lifestyle, because they were maybe depressed or anxious or whatever it might have been. And if they had had the mental health resources earlier, they could have been better, healthier there, and been able to choose, those other healthy options, and avoid becoming diabetic, right? Because they didn't have the coping mechanisms to deal with their mental health issues. So I often recommend that, like, that's a great place to start for a wellness program. And because it helps not only get better care for members, but also mitigate and manage costs too. Because a healthcare,
I was going to say, from a business agent perspective, a good business agent hears that and knows that about the plan and lets their members know. Be like, look, you know what? If you can go to urgent care, it's going to cost you $15. If you're going to emergency room, it's going to cost $100. Now, by all means, bone sticking out of the leg, yeah, you're going to the emergency room, but save yourself some money.
Right.
Go to the urgent care, because a lot of people, urgent care doesn't even cross their mind.
No, right. Depending where you're from, too.
So what?
And depending where you're from, if you're from a different country or a different state, a lot of care providers in other areas outside of California don't have urgent care. And so they don't even know it's an option. So it's not that they don't, care about cost, but they may just not know that it's available, right? Um,
Mm-hmm.
so yeah, it's a great thing to acknowledge and promote for members.
Okay.
Um, and so I know we're getting kind of to the hour here. So I'll kind of leave off with two questions, but I'll start with the first one. Um, is what are some challenges in understanding benefits? Like, why has it become more of a topic? When you're negotiating benefits, why do you think it's something that? Because I've heard from you and a couple of my clients of them trying to understand the benefits and the difference between a plan directly through us or through Covered California. What's some of the challenge in understanding benefits? And I think you alluded to it before, so like we're taught to understand benefits as or insurance as like hard or as complicated. So maybe that's it. But like, what are your thoughts on that?
Well, my first thought is plan to plan and trust to trust. There isn't a uniform model for presenting summary plan descriptions. And so if I have a Barry Automotive Trust plan and I want to compare it to a Teamsters Managed Trust or a Teamsters Benefit Trust or a North Coast Trust, I can't just lay them all side to side and go line by line and, do a quick analysis on, which plan is better. The information is presented very differently. And so I actually have to like create a new document in Excel to line up, these things so that I can compare them. And most people don't have the time to do that. they don't have the resources. You got kids you're trying to feed. You're trying to, pick people up from daycare. You don't have, it's my job, right? Like I got nothing better to do than my own job, so I do it. But who else is going to do that? Summary plan descriptions they're great documents individually, but as soon as you start trying to compare them, it's work. It's actual work that people get paid to do, and that's something that we would all be better served if there was some sort of uniform understanding on how to present that stuff. And then I think the other thing is, and I've got this issue right now. I've got a member who retired because he had a heart attack, and he has a lifetime medical plan. He retired because he had a heart attack. That's it. We're done. He needs cardiac care. But he didn't ask the questions that he needed to. He didn't come in to see member services. He signed up for what looked like the right thing, and now he can't go see his cardiologist. And now I'm hearing from the plan that he can, sign up again next year. And he needs to see his freaking cardiologist. There's no way that mistake should have happened. And that's, a lot of people dropped the ball there getting that done, right? Questions should have been asked multiple times, multiple levels. Like, what is your most important need right now? Is this plan going to meet that need? Because right now I'm going to be untangling this ball of wax for probably 2 weeks. It's going to take a lot of freaking hours, but I'm going to do it because this guy needs to see his cardiologist, and he doesn't want to go see a new cardiologist that hasn't followed him before, doesn't know his history. And the only real issue in his life is his heart attack and his need for cardiac care. And that's the only thing that we're not getting done right now. So, we need to be better about creating documents with, in our mind, the end user being the least sophisticated person utilizing this service. And because a guy like me, I'll figure it out, right? Like I said, I got nothing better to do than my own job. I will do it, right? But I've got 5,000 members that don't get paid to do that. And so that's the thing that really is the biggest challenge to understanding benefits, is they're just not presented in a way that's uniform or easily understandable to people that don't do that for a living.
Yeah, and it's funny because part of the ACA was to do that. That was one of the things or measures, if you will, of what came out of that was to have a uniform way to present benefits. And yes, every healthcare provider presents benefits in the exact same way. I don't know if you've seen the summary of benefits, I think it's called. but
Hmm.
nobody uses it. I hate it. I remember when it first came out, I couldn't even like understand the benefits that well. Yes, I could do a side to side, but that thing is like 6 pages long. Anyways, my point is, while there was an intent in the industry to get to that, what you're saying, I think the challenge remains that the benefits are not easily, like, you can't compare very easy. I don't have the answers for all of that. I can tell you personally, if you ever need benefits, and this goes to anybody listening, you need it side by side. I'm happy to help you. I will maybe make that spreadsheet for you. I have the templates myself, of what to look for in benefits, the most crucial ones at least. There's 5 core ones, but I can help you with that. But and then the other thing is, and this is now speaking to Kaiser, and I'm not here necessarily to like um, promote Kaiser or nothing like that. Just I do work for Kaiser though, so I'm familiar, and I'm sure the carriers have something similar. We do have people that can go out and talk to members to understand their plan. So if there is like one site where there's a good number of Kaiser members, unfortunately we can't speak for the other plans, but we can help people understand their Kaiser benefits. And a lot of times people like to have that verbal, exchange, so they don't have to go to member services or anything like that. They can just we can come onto the job site, talk to them over the phone, especially now with COVID and everything. So it's not gonna break down all of the challenges, I know, but if that helps you in any case, in any way, I mean, um, just know that I'm happy to help out. I know we do have people that can go talk to members. And then the last question I have that we'll wrap this all up with is, what isn't talked enough about, um, when it comes to benefits? Like, what do you think needs more? And maybe you've kind of answered this question already, so this might be redundant. But what needs more exposure, when it comes to like benefits um, and health?
So, yeah, I mean, I've already mentioned mental health services are, one of
Mhm.
those things I think are really, really underexplained and underutilized, and then also negotiated out because people don't value them, they're undervalued. So mental health
Yep.
services and addiction services
Mm.
are the two biggest things that, I mean, those are the things that will ruin your life faster than anything else. And
Yeah.
those things that people are embarrassed to utilize, people don't understand the benefit gets negotiated out. I mean, people just don't appreciate how important those two things are. And we need to
Yeah.
talk more about, we need to talk them up more. We need to be more
Mhm.
vocal with people about how important these things are. And,
Mhm.
we need to work harder to make sure that they are available at an affordable and easy, process so that people can have access to them. That is that's my thing. You know,
Yeah.
Everything else I think as a community and as a, you know, we figured out how to treat a heart attack. We
Yeah.
figured out we figured out how to manage diabetes and most other chronic diseases. We have not figured out
Mhm.
how to get people to say, I'm hurting, I need help, and I need to talk to somebody. And it's a shame on us. We need
I
to
love that you
help
bring
people.
it up. Yeah, I love that you bring that up because from a cost perspective too, a heart surgeon compared to a therapist is a quarter of the price, right? In terms of
Yeah.
the utilization and and overall, but the benefit, of having a therapist or like a mental health professional, addiction doctor, or I don't think they're called addiction doctors, they're called addiction health professionals. But having that sort of care, um, is just, and we're starting to see it in Kaiser reports. Again, you can see this with other carriers too, but like, you're seeing more details about it with the Kaiser reports that show, outpatient visits, and then it breaks it down to outpatient of substance abuse. Um, and you can see the volume and the cost. And a lot of times we're seeing the volume going up because as a society we are seeing, and this is across America and across the world, not just Bay Area or Kaiser, but we're seeing it consistent across the board that more people are seeking these services. And there is a big benefit to it. And so you'll see the volume going up, and yet the cost is not necessarily driving, it's not driving the cost of things. Because like I said, the cost of these services are not at the same rate as some of these higher intensive services like a heart disease doctor, right? That's going to be much more expensive because it's a much more specialized type of care. But a lot of times we can avoid people needing these, heart surgeries or diabetes care or anything like that if they're able to take care of their mental health first. So there's definitely correlation, and we can go into so much more into that, especially me. I can talk your ear off on this, but but I love that you mentioned that, that addiction and how getting the proper care for it and taking away the stigma of, the shame or the just overall stigma of mental health, of needing mental health is something we definitely do need to talk about more. And I'd love to have more conversations with you if you want about that. We're definitely putting emphasis as an organization. We're putting more emphasis on it. Part of the challenge too is that as a nation we have a shortage of mental health professionals. So getting care has been a challenge, but there's been more need, and so there's been more. Things are shifting. Things are changing. I don't think they'll stay like that forever. But anyways, we are at the end of our session. I had a couple questions. I think I'll just go over them, and if they don't fit into the recording, we'll take it out. But if you don't mind, Tom, just sharing a little bit about you and who you are, and just so that people know, just a little bit about you, make it a little fun at the end. So what was my question? Sorry. Oh, so what's one place you want to go to once this pandemic is gone? Like, where are you jumping on a plane to?
Man, so there's two things. I want to go back to the East Coast because my wife's family's out there, and I know that she's heard bad. She hasn't seen them, and that's been really hard for her. But I also want to dig a really big hole and buy a pig and have a big fat luau with all my friends and just get stupid in the forest. Like, that's all I want.
Isn't that Burning Man?
No, Burning Man's way too many people. I'm talking like my 5 best friends and their families.
Okay.
And just turn off our phones and just be us for a while.
That's awesome.
The people that I truly, truly miss for the dumbest reasons, but they're my people and I love them. That's this year, right? We can't even have a freaking barbecue.
Yeah.
What about you?
That sounds amazing. I would definitely stop by for some chicharron if you do that. Deep fried pork skin. if you do that. For me, oh God, almost anywhere. I think I'd just show up to the airport and be like, I packed everything. Just take me there. Where would I want to go? I want to go to Spain. I want to go back to Spain. I studied abroad there, and but I want to explore, just different parts with my son. Take him somewhere. Well, first we'd go to Disneyland, because I swear at least once a month he asks me, when this virus is gone, can we get on a plane? And he's specific. He doesn't say he doesn't want to. He's specific how fast he wants to get there. He says, can we jump on a plane and go to Disneyland? At least once a month. I kid you not. And so I told him over and over yes. So we're definitely doing that first, and then jet set somewhere international, nice. Someone that's not here and where we don't have to hear politics either. So an escape. Um, well, thank you again, Tom. It was wonderful talking to you, and I loved hearing your perspective. And so happy that um, your local has someone like you, and all of you guys over there, Mike and Juan, representing them because I can see the great work that you guys do, and the intentions and the, all of everything that you keep in mind when you do what you do. So I appreciate it, and I hope you have a good rest of the day.
Thank you, Lucy. This has been fun, and it is fun working with you. So we'll be talking soon. I
Yeah,
appreciate you.
for sure. Thanks, Tom.
Yep. Bye.
Bye.